Today, we are going to look at a BodyViz brain builder about synovial joints and dislocations. The definition of a joint is the junction of two or more bones. Any joint can dislocate, but the chances of a dislocation are not the same for all joints. The chances for dislocation of a joint are directly proportional to the possible range of motion at that joint. Synovial joints, also termed diarthrosis joints, allow for the greatest range of motion. Therefore, synovial joints have the greatest possibility for a dislocation. There are 7 anatomical characteristics of a synovial joint, which are a fibrous capsule, a synovial membrane lining the inner surface of the joint capsule, secretion of synovial fluid by the synovial membrane. This fluid fills the joint capsule, nourishes, and lubricates the hyaline cartilage, covering the articulating surfaces of the bones of the joint. Hyaline cartilage covering the articulating surfaces of the joint. Presence of localized connective tissue thickenings of the joint capsule. These thickenings are termed ligaments, and they serve to limit extreme range of motion at the joint. Small blood vessels and capillaries penetrating the joint capsule. And lastly, sensory nerves, supplying the ligaments and the external layers of the joint capsule with the receptors for proprioception and pain. The more mobile a joint is, the less stable it is. Joint mobility and joint stability are antagonists of each other. The more one means, the less of the other. The 3 most important factors contributing to the stability of a synovial joint are the shape, size, and arrangement of the articulating surfaces, the structure of the joint capsule and ligaments associated with the joint, and third, the musculature surrounding the joint. A joint dislocation, also termed a joint luxation, occurs when the bones that participate in a joint become separated. Next, we will look at the symptoms, causes, and treatments for a joint dislocation, and finally, give a patient example. Symptoms of a dislocation include pain, muscle spasms, reduced range of motion, swelling, and a deformation of the joint. Joint dislocations are typically caused by sports injury or trauma, muscle imbalances, a congenital laxity in the joint, or a direct impact, such as a fall. Treatment for a dislocation depends on the joint affected and the severity of the injury. Immediate application of ice and immobilization of the joint is highly recommended until medical examination is possible. Further treatment often includes medication to reduce pain, manipulation of the joint in order to return the bones to the proper places, rest and temporary immobilization of the joint, rehabilitation in the form of physical therapy to strengthen the muscles, tendons, and ligaments around the joint in an effort to reduce the possibility of future dislocations, and surgery for severe dislocations. Anyone can suffer a dislocation. Those at higher risk include anyone prone to falls, anyone with an inherited joint disease, and anyone involved in contact sports. Most dislocations will heal completely, and pain is significantly reduced once the bones are put back into the proper place. Finally, let's take a look at a patient example. You are working in the ER when a new patient arrives. You take a look at the patient file. Age 16, sex female, chief complaints, deformity and extreme pain of the left knee with the inability to bear weight on it. You step into the patient's room and see that your patient is in extreme pain. Just by looking at her knee, you can see that it is swollen and deformed. Your patient's parents arrive and explain how she was in the middle of a volleyball game when she dove for a ball and then was in immediate pain on the floor and could not get up. The athletic trainers helped her get off the court and sent her to the ER for a possible knee dislocation. You send for an X-ray, which confirms a dislocation of the knee, with a possible stress fracture. You start planning for an immediate surgery to repair the bones, with hopes of minimizing and correcting any possible issues with the vessels, nerves, muscles, and the ligaments. Your patient undergoes multiple knee surgeries to improve mobility and restore the lost cartilage with cartilage transfers. Your patient has a long road to recovery that includes physical therapy to be able to walk and use the joint efficiently again. This is a classic example of a knee dislocation. Want to see more 3D anatomy and patient case examples? Check out BodyViz, a 3D anatomy learning platform and virtual dissection software. Go to bodyviz.com to learn more.